When I first took the intro course, I definitely didn't go full steam ahead. I would say that I was able to get out there and network more, started getting more serious with networking and building the business. And then by beginning of 2020, completely done with hygiene and slowly just kind of took my hygiene hours away as I was getting busier with Myo. In the beginning, I was doing Myo pretty much any chance I wasn't doing dental hygiene. It's a different mindset that you have to have as a myofunctional therapist.
Good evening, everyone, and welcome. I am Lauren Gates, your host of this evening's conversation, and we are excited to have Brittny Murphy back, who's also on our faculty and the director of School of Myo. Welcome, Brittny. I know this is kind of maybe a continuation for some, and welcome everyone who's joining us. But we had a Q&A session back in January to kick off the year, and there were just so many questions and so much interest that we said, you know what, we're going to do this every couple of months because sometimes, people might dive in at a different time, or maybe have new questions that they want to ask, and there's new questions every time. So I'm really excited about having the session and the interest. We had about 300 register tonight, so I'm excited about that. But let's see who's with us tonight. We'll go ahead and take a poll and see who's joining us. It's going to be an exciting evening because we're going to have a free raffle at the end. You must be in attendance for the whole time. This is like a $3,000 value, and not only that, the value of a lifetime. Because if you're one of these lucky winners who's on the fence and you get to this course, this introductory course with Brittny, it's going to change your career. So I'm really excited about who our winner is this evening. But hang with us till the end, and we'll spin that wheel and see who wins. But it's nice to see we have a mix, mostly dental hygienists this evening, but a mix of dentists, pediatric dentists, no orthodontists tonight. We already have existing OMT, so welcome, and feel free to join us in the chat if you want to share your expertise. We love that as well. Speech language pathologists, and a couple of physical therapists this evening. So welcome, everyone, and thank you for your commitment to learn more and to be with us tonight. I am going to do a couple of disclaimers just because it's better safe than sorry. So let me just run through this and then we'll get to the fun stuff. So the views presented are the opinions of our speaker and are not necessarily affiliated with Lauren Gates and Associates and Airway Health Solutions. And the following webinar is provided for educational, informational purposes only, does not constitute providing medical advice or professional services, and the information provided should not be used for diagnosing or treating a health problem or disease, and those seeking personal advice should always consult with a licensed physician or dentist. And some more housekeeping items is to receive your CE certificate, you must be in attendance for the full hour, and our Zoom software tracks attendance. So we do not need to give you a code or a survey. So please just be patient with us because we do have a lot of people. It's pretty manual that we will get you your certificate, usually about 7 business days. So stay with us to the end. You'll get your CE, and I'm so excited for one lucky winner to take the intro course. So all right, well, let's kick this off. And for those who haven't met you yet, Brittny, let's talk about just being a myofunctional therapist. And, I hear so many wonderful things about you as a myofunctional therapist, but also from your students that have taken your course, because somehow you are able to keep that passion alive. And you've been doing this now for how long?
5 years? Or
5
Myo or the teaching? Teaching 5 years.
Teaching 5 years. Myo, how long? How long have you been a myofunctional therapist? 10. Okay, so you just went out. Right. So you're my functional therapist. And how long did it take you to transition from a dental hygienist to a myofunctional therapist? And what did that transition look like?
That's a great question. So when I first took the intro course, I definitely didn't go full steam ahead. There was a lot of stuff going on in my life at the time. So once I would say that I was able to get out there and network more, I'd call that. So 2016, I took my first course. 2018 is when I started getting more serious with networking and building the business. And then by 2020, I was completely done. Beginning of 2020, completely done with hygiene and slowly just kind of took my hygiene hours away as I was getting busier with Myo. I will say in the beginning, it is very common for hygienists to be doing both. I haven't met many that are able to just completely go full time, unless, of course, you're doing this in your existing dental practice. You guys are already, doing airway dentistry, and there's that need for a full-time myofunctional therapist. Um, in the beginning, I was doing myo pretty much any chance I wasn't doing dental hygiene. So I was still
Okay.
doing full-time dental hygiene. I would come home, see patients from like 5 to 7. I had Fridays off from hygiene when I was working full time as a hygienist. So Fridays were like my myo day. And then, yeah, just the busier I got, the more time I was able to put aside to myo and pull away.
And then what advice would you have for someone who's just saying they're going to sign up for the course or new alumni who have signed up for the course to get started? Like, what is the biggest barrier you think to actually implement what you've learned? Is it fear? Is it
I was going to say
resources?
yourself.
Okay. Mhm.
That, a lot of us, especially, and I can only talk obviously for dental hygienists, and maybe not everybody on here is like this, but most of us dental hygienists are very like type A, and it is a different frame of mind when, oh, a thumbs up is coming up on my screen. Thank you.
Okay. Look.
Emojis. It's a different mindset that you have to have as a myofunctional therapist because our personalities, like we want to have this set protocol that we can follow for every single patient. And it is not that way with myofunctional therapy. Every myo patient, it's individualized. Like my mentor would say, every patient's like a snowflake, right? Everybody's different. And so I think that my dental hygienists, when they take the course, like they're nervous to get started. They're nervous that they don't know it all. I mean, think about how you are as a hygienist graduating hygiene school, right? Like everybody's nervous to get into the real world. You don't have your little, whatever they called that garbage bag hanging over to grab your pen, and like you're not doing any of
Right.
that crazy stuff, right? Like you're in the real world and you're nervous because it's new. Doing something new can be nerve-wracking, but you need to just get out of your comfort zone. So my biggest piece of advice is like literally just go for it. You have all the skills that you need by the time you finish your myofunctional therapy course. You just have to start practicing and you have to gain that experience, and you can't let that fear hold you back.
Wonderful. Do you ever miss clinical hygiene?
You know, no, but sometimes I wanted to be a dental hygienist since I was 7 years old, which is so strange. Not even a dentist. Like I always knew I wanted to
Yeah.
be a dental hygienist. So I would say no because I just love what I do so much as a myofunctional therapist. But there was a time where somebody had asked me to temp for a day, and I was like, fine, I'll do it. And I was like, oh my God, I do kind of miss this. I loved being a clinical hygienist. I really did, but I can't, my calling is being a myofunctional therapist, and I can't ignore that.
And then what would you say would be the, I guess, soulful or spiritual benefits of myofunctional therapy? Like, talk about that. We don't hear a lot about the soulful journey that you go through with your patients and maybe how that is parallel somewhat in the dental hygiene world and then how it is different.
Yeah, I mean, we touch our patients' lives every day, regardless of what we are in healthcare, right? I know just again from personal experience, it's exponential the difference that you can make in a patient's life being a myofunctional therapist and changing somebody's, if you're working with a pediatric patient, say their complete trajectory of life, right? Now, of course, working with adults, it's never too late. We can, but to be able to work with a small child, and as you get more evolved in the airway space, like when you're working with a child, if they don't, go through with expansion, if they don't go through with myofunctional therapy, you almost could like foresee what their future is because those are the adult patients that we're seeing every day. So to be able to make that change at a young age, 3, 4, 5 years old, it's incredible. And then, I feel like I have such a new perspective now being a new mom and going through already like the tongue tethered oral tissue releases with my girls. I have such a new perspective on it, like what it's like going through it as a parent. I mean, you're going to have these I just got the chills thinking about it, like literally crying in your office because they finally feel like they're being heard. And
Mhm.
that is a common thing that you will hear amongst families, really in the airway space.
Tell me about your collaborative team. So it's different again, right, than the dental lane, so to speak, unless you're in airway and you have more of that interdisciplinary collaboration. Who do you collaborate with and how did you do that?
Yeah, that's a really great question too. This always comes up in the course. And we have a whole lecture on it because it is so
Mhm.
important because there's one thing you need to understand is you can't do it on your own. And yes, myofunctional therapy is a huge component to any treatment plan. it is not going to be the only thing. You need to have that team of, superheroes with you. So who you're going to collaborate with, it will depend on the age of the patient, but I mean, really whether it's a sleep dentist, a sleep physician, you might collaborate with somebody's cardiologist or pulmonologist, an OT, a PT, a feeding therapist, a speech therapist, a body worker. Of this, like I just recently started referring back and forth with somebody that does vision therapy that's in our local
Mm.
community. So the list is really endless because whenever you get a patient, that is going to come into your clinic, everything's connected. Like everything throughout our body is so connected and it all goes back to the way we breathe.
Well, let's talk a little bit about the training that's required to become a myofunctional therapist. And there's a lot of mystery here about certification. Can we just clarify what it means to be certified? I know the course that we offer is part of the IAOM. What's that all about? But let's focus a little bit on certification and any questions surrounding that. Everyone can kind of also ask in the Q&A. But let's bring up this whole certification mystery.
Yeah, that's always a big topic as well when we
Hmm.
first get started because everybody's like, oh my gosh, I'm going to take this course and then I can't do anything until I become officially certified. And that is not the case. Literally, when I took my first myofunctional therapy course, um, I started seeing patients like literally that week. What I had done before, and I'm going to get to the certification part, but I want to
Sure.
just suggest this to
Build
people
up.
that are
Yep.
going down the myo route. Start networking like ahead of time. Like I reached out to local orthodontist, local pediatric dentist, anybody that I thought might have, an interest working with a myofunctional therapist. Now I didn't get a lot of doors that were very welcoming to me. I only got a few, but that was good enough for me to want to go and take my first course. So this particular orthodontist, he already had patients lined up for me. By the time that I took my first myo course. So literally it was like the end of April, that last weekend in April, I took my course. And that second week in May, I had started seeing my first patient. And I was not certified. Okay. So you do not
Hmm.
have to be certified to practice myofunctional therapy. However, I strongly urge you to go the certification route. I think that it's going to show a level of competency. I think when you're networking with other providers to be able to have so the IOM, the International Association of Oral Facial Myology, there's a lot of acronyms in the myo space.
Hmm.
You would receive your COM or COM certification, which stands for Certified Oral Facial Myologist. It is the longest standing certification out there. The IAOM was put together in, I think it was like 1972. There are other certifications that exist out there. There's quite a few actually. But I think that again, COM just being around the longest, I think that it's the one that is most widely recognized and the one that, again, when people look at your name and they see that you have your COM after it, there's going to be this added level of confidence in the type of treatment that you provide.
Well, but it's not like you're a registered myofunctional therapist. There's no, it's not, you're not
Yeah.
licensed by the state. So talk about that a little bit as
Yes,
well.
yes, that's also very important. So it is literally like a trademark. So you're going to see after all of these certifications. So I have my my COM, I have my QOM, and you'll see the little trademark symbol after it. It is a certification. That's all it is. It is not a license. It is not being a licensed dental hygienist. There is no government, no board that's overseeing it. Um, so again, that's why you don't have to be certified to practice. There is no governing body like we have, our state dental acts.
And now who can be a myofunctional therapist under their scope of work?
Yes, great question too. So I would say a majority of us are either registered dental hygienists or speech language pathologists, but I do know some wonderful OTs, PTs that are myofunctional therapists. There are dentists that are myofunctional therapists. I think that there's other things that they can be doing with their time and they should send their, dental hygienist to take the course and become a therapist. You do have to have a healthcare license, so you can't be like, Joe Schmo coming off the street, looking to get into this field. Most of the courses that you will see out there, the reputable ones, they are going to ask for like your license number, whatever it is, whether you're a hygienist,
Mhm.
speech, whatever.
There's a question from Michael Lyons. Do you have your own facility or do you travel?
This is a great question. So currently, so in 2020, yeah, because it was COVID. March of 2020, I got my own office space for the first time, just to give you guys what my story was, because you're gonna see a mix of things, and that's one of the really cool things about Myo is that nothing has to be permanent, right? Excuse me. In the very beginning, I had a home office. And then I had a home office and I was renting space 1 day a week from an orthodontist, 1 day a week from a general dentist. I also did some home. I traveled to homes for a little bit within a certain mile radius from where I was. I did that. I currently, like I said, I have my office space and then I have a satellite location that's about like an hour away from where I am just to serve a larger population in Connecticut. So currently, I go there once a month to my satellite location, and otherwise, I'm in my home base. But the other awesome thing, too, aside from having all these different ways that you can practice Myo, you also can practice it virtually, which is huge. So I see patients in Connecticut, I see patients in California, I see patients in Italy, anywhere, but internationally. We treat patients globally.
It's a wonderful option, especially because you can do this completely virtually if you wanted to. Does it depend on the individual state practice acts to be able to practice as a myofunctional therapist? Seems like we're getting some pushback from the DOL in the state of Utah.
So yes, you do want to make sure to check your state practice act. The thing is there aren't a lot of state practice acts that actually come out and say or make it very like transparent whether a hygienist in that particular state can practice myofunctional therapy or not. However, there are two policy statements in the ADHA. And for anybody that's not in the dental field, ADHA is American Dental Hygiene Association. The first one was from 1990. Don't quote me on this, guys. I think it's 1991, 1992, one of those, saying how it is in our scope of practice as dental hygienists to practice myofunctional therapy. And then a second one which was more recent, was I believe it was 2021. Again, stating that it is in our scope of practice, to diagnose OMDs, which are OMDs are, I'm sorry, oral facial myofunctional disorders.
Thank you. So to be certified, do you take a board exam? Good question,
So
Jessica.
great question. So this will vary, depending which institute you're going to go to. So again, I can only speak for the IAOM. I'm actually on the board of the IAOM. So what it does consist of is there's a written exam, like a multiple choice question with a written part to it. And then there is an actual on-site exam. And that's the part I love about the IAOM. To my knowledge, none of the other certifications have an actual like on-site part. They have like written case studies, of course, like making sure that you're competent in treating somebody from beginning to end. But it's really cool. Like I remember, when I was going through the certification process and I actually had my examiner was in the same state that I lived in, which was nice. But they watch you they watch you literally do therapy at different stages of therapy. So like an evaluation, maybe your first session, halfway through, the end, they want to see somebody after graduation. And again, it helped give me more confidence, I think, as well, like going through it. And I'm just a nerd. I love the written part of the exam. There's just so much research and there's always something new for you to learn. So I really enjoyed, as maybe weirdly as that sounds, going through the whole process of getting my certification.
And what does that process look like? So you would take your intro course. Tell us a little bit about your intro course, just hours wise and commitment wise, and then we'll go into a little bit more of the specifics later. But
Yeah. So it's a 28-hour introductory course. So what happens is when you register, you get access to about 9.5 hours of pre-learned content. And then we offer the course 4 times throughout the year. And starting on the day that the course is offered, which is going to be a Wednesday, every Wednesday for the next 8 weeks, because it's an 8-week course, a lecture is released and you are able to watch that up until that following Monday, which is our live Q&A. I love having it structured this way because I would have loved, absolutely loved to be able to go back and watch my first introductory course, or have the ability to like pause my instructor, rewind what she's saying, slow it down, like whatever. There's so much information that you are going to get jam packed with, and you have lifetime access to this, which is another thing that I wish I had. And then, we all have crazy lives, like whether it's kids or I don't know, maybe, I don't know, you're single and you're dating and like you don't want to spend your nights with me listening to me lecture. You want to watch me in your
What?
own time, whatever.
Imagine
It's
that.
it's nice to be able to watch it in your own time. And then we meet, like I said, on Mondays for an hour to literally like dissect that entire lecture. The Q&As are my absolute favorite part. The questions that everybody asks are just invaluable. And then, oh, I wanted to mention that the lectures, they're generally somewhere between an hour and a half each week.
They finish the intro course, then what? What is the
Yep.
time commitment to get the certification for COM?
Yeah, that's a great question too. So once you finish the course, you are going to be presented from Airway Health Solutions with a certificate of competency, like completion of the course that says like you took a 28-hour introductory course. We don't do, we're hands off from the certification as like Airway Health Solutions, but you get this certificate from us and then you are able to apply for the certification process with that proof that you took your course. You actually have 5 years to go and complete the whole thing. So the written part, the on-site. I will say generally, so we call them when you're in the process of getting certified, it's called being an on-track COM. Um, and I would say at the very minimum, my guess would be it would take close to a year to get certified if you go full steam ahead. Because remember, I said that when the examiner comes out, they're going to want to see a patient that you have already completed therapy on. And typically we're in therapy with these patients for like a minimum of 6 months. So I would say give yourself like a year if you're like fully committed and, going to get it done right away.
Great. Well, thank you. I think that those were a lot of the questions that I received. I just kind of trying to put it in some kind of order so we're not
Yeah.
bouncing all over the
Yeah.
place. But let's pick up the live QAs that are coming in. Do you take HSA and FSA cards in your practice?
Yes, I do. So we take HSAs, those usually aren't a problem. FSAs, sometimes you need like a little bit more of a detailed receipt. It really is going to depend on the particular company, but yes, we do take both.
And Kylie has a great question. What's the difference between the live Q&A course versus the on-demand course that we offer?
Very good question. So this is really important for everybody to hear because our on-demand course does not include those Q&As. So you are getting 8 hours less of CEUs. And in order to apply for certification through the IAOM, you have to have a 28-hour introductory course under your belt. So I would say the on-demand course is more for somebody, maybe like a dentist that wants to be able to support their myofunctional therapist that they're working with and know a little bit more about the ins and outs of myo. Somebody that, maybe already took an existing myofunctional therapy course, but it just maybe wasn't enough for them to feel confident. Um, we are going to have the option where if you do take the on-demand course, we'll have something in addition that will give you those 8 credits, but it will then be also obviously an additional fee. So in my personal opinion, if you're just starting out, I highly suggest the 8-week course. Everything's recorded. So even if you can't make the virtual Q&As, you still get access to them. And then that way, I just know for me, I feel like if you're just starting out, you don't really want to miss those Q&As. You're going to have a lot of questions.
What was the testing for your COM? I have been graduated for a while and feel rusty with my testing skills.
Oh my gosh, my brain since being pregnant and then becoming a mother is like mush. So I don't remember exactly, but like I said, I remember I enjoyed the process. It was lengthy. I will tell you that it is going to be a lot of work, but I feel like most of us that get into this space, like we love research, we love learning, and it just took everything that I learned, in my course, um, and added so much more to it. I mean, they provided you with like, whatever research articles you had to read to answer questions and whatnot. It's not like you had to do, go out and find these crazy research articles on your own. They are provided to you. But yeah, I don't know that I can answer that. I don't remember. I mean, I'm not going to say it's easy because it shouldn't be easy, right? I mean,
Yeah.
we're going and we're treating patients after this.
Okay. Can you work in Canada with this certification?
Okay, I want to say one thing because I'm wondering if this is what that last person was getting at. It's open book. It's not like, hygiene wise where you're in this testing center and you have to know all the answers. Like you were
Oh,
able to,
okay.
yeah.
Okay, that's good
Um,
to know. I didn't know
yeah.
that.
Can you work in Canada with this certification? So we have a lot of students actually from Canada, but I will say definitely look into the laws, within your district and see exactly. I don't know if you need the certification to practice, but if you reach out to me, I'll give you my email address at the end. I can connect you with some of our prior Canadian students who will be able to answer that much better than I can.
There's a couple of questions here about the medical, the dental, and then the compensation, talking about that. And then how do you come up with your fee schedule, all of that. So let's tackle the medical dental insurance first.
So just so everybody knows, this is all covered in the course because this again is a very important part. It's not just about like the clinical therapy, but we also have to know how to run a successful practice. So with that being said, it is not dental, it is medical that you are billing. There are no myofunctional therapy codes that exist. So oftentimes insurance is not going to cover this. For any speech therapists that are on this call, you are more apt to getting coverage because you can also do speech in that, 30-minute, 45-minute session, bill for speech codes, and then, obviously get the session paid for. But we're a little bit more tied as hygienists or dental practices. So, but the codes that I provide to you in the course are medical codes. They definitely aren't dental codes. And we talk about how to even submit like a medical
Yeah.
claim for your patient if you want to go that route. And then the other question was about fees. So fees are going to vary geographically with where you are. Typically, my recommendation is to contact a local speech practice near you and see what they charge for a session of speech. It's going to generally be around there. I will say on average, people right now are, I would say 150 is pretty average. But I see crazy high numbers like 500. So it's really going to matter where you are.
Don't start there. Don't start with the
Yeah, don't
500.
start there.
Can you open up your own practice as a dental hygienist, but work as a myofunctional therapist?
Can, can
Can
you
you
open
open
up
up?
your
So
mind?
I guess it's saying, can you have your own myofunctional practice as a dental hygienist?
Yes. So I am a registered dental hygienist and I have my own myofunctional therapy practice. I actually own one and co-own a second. You can. So here's the thing. When you are practicing myofunctional therapy, you are not practicing dental hygiene. And it's very important that you separate those two to protect your license because of the way, again, things aren't clearly written in our state practice acts. That's why you're always going to hear, no matter what myofunctional therapy course you take, to make sure that you separate the two. So you don't want to have both hats on at the same time. And if you're a myo doing this in your current dental practice, same thing. Like you're not going to go from doing root planing to myo, back to a prophy, back to myo. It needs to be very split. And that's just for everybody's own protection.
Do you need an LLC?
Yes, so we also talk about this. So you do need some kind of business entity. It doesn't have to be an LLC. There's other options like S Corp, other options that we'll talk about again in the course. You do want to have your business registered. You want to have business insurance. You want to have an EIN. If you are going to bill insurance, you're going to have an MPI. You're going to have an EIN. An EIN is an employer identification number. It's basically like, as a what would I call myself? Just as me using my social security number as a business, you get your EIN number. That's what you're putting on all your W-9s and whatnot.
Okay. Is there anywhere to take a class in person is one of the questions, but I do want to touch upon what you do offer, which is really unique, is the in-shadowing office opportunity. And then also the WhatsApp group, and tell us a little bit about, so we don't offer a class in person. I don't know if there are any anymore.
Yeah,
You may know that.
there
Yeah.
might be a couple. I want to say Pat Pines's courses
Okay.
in person, if I'm remembering. So again, this is my biggest recommendation. I mean, of course, I hope everybody takes my course because I want to meet everybody. I want to help everybody along their journey as a myofunctional therapist. But if you're listening to me tonight and like you're not vibing with me, don't take my course. It's very important that you feel a connection with the person that you are going to learn all of this from because they're not just going to be your instructor for that 28-hour course. More often than not, they're going to become your mentor. And so I always suggest like reaching out to whoever the instructor is, having a conversation with them, listening to their story, and starting there. Now, some people say, oh, I'm only an in-person, I only can go to classes and I only pay attention if I'm sitting in the room or something. Like I've heard that a lot. I mean, that
Mhm.
might be true when you're like, I don't know, going and you have to take the CE, like because you have to. You're not doing this because you have to, you're doing this because you want to. So I promise that like all of this 28 hours of material, there's not going to be a second where you're like snoozing, going to get your tea or coffee. You're going to want to take it all in.
There. There's a Dr. Mahmood on is asking, he says he's a general dentist. Which route should I take to first understand myofunctional therapy and second to apply it in my own practice?
Great, great question. So I would love it if every dentist that was going to offer myofunctional therapy in their practice took a myofunctional therapy course because you need to know how to be able to support your hygienist slash myofunctional therapist. So I would say taking one of the courses. Now, again, if you want to just take the on-demand course just to get more of like the didactic stuff, sure, you can take that. We have had some dentists, a few, in our actual 8-week course, and that was really cool to have too. My favorite is when we have a cohort that has all different disciplines because then the Q&As are even more fun. But I would definitely start by taking an introductory course for sure. And again, if you want a little bit more information about on demand versus the 8-week course, feel free to reach out to me. And then I think once you understand more about myofunctional therapy, I think it's going to be easier for you to implement it into your practice, but I can also help you with that.
I just want to make sure, I'm not sure we may have touched upon this, but it's a little bit more specific. Does one have to travel to write the COM? I guess to take the test or,
No, 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 no.
okay, okay.
Nope. The only
That's what I
thing
thought.
is like, so we're kind of in the process of like changing things a little bit. So just keep in mind that like what I'm saying tonight, we're literally like we have a board meeting on Sunday, and this is like something we're talking about. It might be a little bit different, come, I don't know, when we put everything out there, but currently, an examiner again has to come out. I will say if there isn't one in your state, you are responsible for their travel, their food, their board, and all of that. So there is definitely cost associated with getting your COM right now. There was, during like COVID and all of that, there was more virtual stuff going on. So again, we're figuring out how we're going to proceed with that. But the written part, no, you're not going to like a facility for.
Is there an opportunity to network through the course and observe another myofunctional therapist? So you want to talk about the shadowing?
Yeah, so this is a great question. So obviously I'm in Connecticut. We do have an option where you are welcome to fly out to Connecticut and come to my practice. I have a practice of myself and 4 other amazing myofunctional therapists who have all taken my course. Spend a day with us, watch all of us because it's really cool again to see different interactions with between different therapists and patients. You can try to call a local, therapist near you. I will say I hear mixed things. Some people are like, yeah, come in. Like I say, yeah, come in all the time to people. And then there's some people that are like, no, absolutely not. We don't accept anybody shadowing. So you can give it a try, but we do have an opportunity where you can come out and spend the day with us or spend a couple days with us.
Do you feel like Myo is more widely accepted in larger cities? I feel like small town dentists have a hard time allowing their hygienists to further their education outside of basic hygiene. How did you advocate for yourself?
This is a great question and lots of parts to it. So I'm going to have you break it down question by
Sure.
question. But before that, one thing I just want to say again about that last question, We do also have a virtual option. So if like flying out to Connecticut is not optional for you, and there's some people who are only going to be have virtual practices, you can also shadow us virtually with our patients. Just keep that in mind too. Um, okay, and then this
Okay,
question.
so let's take it one by one. Do you feel like Myo is more widely accepted in larger cities?
Yeah, I mean, I think that, advances in healthcare in generally happen quicker in larger cities than they do in, smaller suburbs and stuff. Um, but it takes one doctor in one discipline in your area to be able to have enough of patients for you to do myofunctional therapy. There are endless amounts of patients out there that would benefit from myofunctional therapy. So don't think that just because you live in this small town that you're not going to be able to network. Also keep in mind, like I mentioned earlier, you can do this virtually. When I first started, there still aren't a lot of Connecticut airway providers. So there's more now than when I first started. But when I first started, I networked in all different states. Like in the course, we'll go over different directories, how to Google search for certain providers. If they're not in your state, you can still reach out to them because a lot of providers are still looking for myofunctional therapists. There aren't a lot of us that exist. You're still in the right time to get into this field. I can promise you it's not a saturated field currently. I hope it is down the line so that everybody can have, access to care. But now is the time to definitely get involved.
The second part of that was the attendees sharing that I feel like small town dentists have a hard time allowing their hygienists to further their education outside of basic hygiene. Let's just break that down because you sponsored yourself, correct?
I did. So I loved the doc I worked for. I loved the office. They're literally my family. They've come to when my child was born, they came to the hospital, like the whole thing. Um, but he was not airway centered focused at all whatsoever. He actually really highly doubted it. But I told him, I'm like, look, I appreciate your opinion. I value your opinion, but this is just something that I feel like I need to do for myself. So yes, I sponsored myself. I paid for my own coursework. And essentially, what I would suggest for those hygienists that are maybe involved in offices similar to this, I just had a conversation with my doctor. It's important that you have the conversation like, is it okay with you that I'm doing my EOE, IOE, I'm spotting these airway concerns. I am going to recommend X, Y, and Z for this patient. If they say no, you're going to feel this major conflict within yourself. And that is probably going to be a time that you're going to feel like you have to leave that office. Otherwise, you're going to be living a double life. So I don't want a hygienist whose current office, if they don't feel supported, please don't let that stop you from doing this because I promise you that you can still be successful. I'm here, right?
Yeah, and email us, email info that we have 800 airway dentists who would love to have a hygienist who's
Yeah,
interested in
exactly.
airway and myofunctional therapy. Let's talk about just a little bit more about the IAOM. It says, I took part one introductory from IAOM, but do you have a second portion for more?
I'm not sure part one. I don't know what they mean by part one from
Okay.
the so Rosemary, if you can be a little more specific, I don't think you're talking about our course.
No, no, I don't think so. I think it's I am part one, but maybe if you've taken one intro course, how do you feel about taking another one? I mean, is it something that you would recommend? I guess it depends on the learner, right? It's
I think it depends on the learner. I think it depends on your level of confidence with the material. I will say that there are certain programs out there that are a little bit more like blueprinted, where it's like a certain, like, say you're going to have a program that's 12 sessions, like every patient gets the same 12 session exercise sheets. And I really don't believe in that. I really believe in a more individualized approach. Like, as a therapist, we should be critical thinkers. We should be able to think outside the box. So we have to know why we're giving these exercises. There has to be a reason that a certain exercise has to be prescribed. So I don't believe in the one size fits all approach. So if you maybe that's the type of course that you took where it felt very like you don't know how to treatment plan. That's one of the biggest things that I hear from other students that have taken different courses is they just don't feel comfortable treatment planning. And that is like one of my favorite things to get into. I actually just came out with and we brought this up before, Lauren, and I don't think we finished talking about like the WhatsApp group and
Yeah.
the things that are
We'll
involved.
go,
But
we'll
I
go
just
through that at the end, but it's just coming up. Yeah,
yeah,
when it comes up conversationally.
there's something that I just created, and it was supposed to be like this little mini workbook for my students, and then it's like an 82 page guide. It's called the Myo Map. That's what I titled it, and I think it's fantastic. And the feedback that I've been getting, from everybody has been really encouraging. It really just kind of helps everybody feel confident after they're taking the course to then be able to, go on and almost have like this guidebook kind of helping you through treatment planning.
And then you also have the WhatsApp group for the questions that come up live.
Yes, so we have a WhatsApp group, like literally, like we're just texting like we're besties, like every day. Somebody's popping a question in there. Sometimes people are answering. If I'm not getting to it, other people are answering, and then I'll chime in later. Like, I just love the community that we've developed. Everybody just wants to support each other. And it's so important to have that ongoing community. You don't want to be part of something that you just take the course and then it stops because you will have questions.
So, Dr. Lyons is a semi-retired ortho here looking for a new challenge. Opinions on Airway Ortho Intersect and the Murphy appliance or any appliance therapy.
Yeah, so my opinions, I mean, every patient that I see as a myofunctional therapist, almost every patient, unless they have already been expanded, more often than not, need palatal expansion. Most of these patients are having airway issues, and we explain it to patients like, the roof of your mouth is the floor of your nose. So if your maxilla is underdeveloped, you're going to have, smaller space in that nasal cavity as well. So I'm a big believer in expansion. I'm a big believer in early intervention. So expansion 3, 4, 5 years old, really whenever there's the first sign that something's not right, right? When we're not seeing adequate spacing between those baby teeth, and patients are suffering functionally and they have a laundry list of symptoms. I don't know what waiting to age 7 is going to do for that patient when they're suffering at age 4.
Ooh, you got your first Myo Map bid. Brittany is saying, is there a way to purchase the Myo Map?
Currently,
So,
it's only offered to our community, our alumni. So I don't have an answer for you right now.
yeah. But that's interesting. Maybe taking one of our other courses, maybe that would, the business course or whatnot. The business course, perhaps.
For what? Say that again, Lauren.
Is that maybe if someone doesn't need an intro course and that they have the option of taking the business course,
Yeah, so
then the Myo Map would be part of that.
yes, the Mile Map does come with our business course as well. And the way that our business course works, like there is business parts in the introductory course because everybody, that's the part, like I know for me, that's the part I struggled with. Like my brain is more geared towards science, not to business. So basically it's like learn from my mistakes. Like don't make the mistakes I did. I'm going to tell you what I did wrong and then don't do that. I'll tell you what is the better thing to do. So if you take our business course that we have on our website, you are essentially coming into our introductory course, but at a later week because you already have the foundations, you already have the background, you already have the anatomy. You don't need all of that, right? But you do need that business part. So you come in at tethered oral tissues week because I think that one course isn't enough to learn about tethered oral tissues. And then I do also, you would get let in for the myofunctional exercises because, it's always nice to hear a different spin on a therapist's like laundry list of exercises. There's just more to add to your toolkit for your patients.
Wonderful. And the course also does prepare, it teaches adult myo as well. So that's one of the questions that I'm just kind of diluting here. Does the course also prepare students or learners to treat adults as well as kiddos?
Absolutely. I would say my myo practice is probably um 65% kids. What's the other part of that? 35% adults? Yeah, I did that math right.
You did that. Did that pretty good for as a new mom. That was quick, quick, quick.
Yeah, so we treat a lot of adults. So yes, it's very important. We don't want to leave our poor adult patients behind.
Here's just a little bit more specific questions. What are your thoughts on the Herbst appliance, Snore Guard, and do you see many adults with CPAPs?
Yes. Okay, so let's break this question down. Do I see a lot of
Mm.
adults with CPAPs that actually use their CPAP? That
Okay, yeah.
answer is no. Do I see a lot of
Hmm.
patients that have a CPAP? Yes. Um, so my thoughts on that, I think that myofunctional therapy is a wonderful adjunct and should be done on every patient that has sleep disordered breathing. You will see in a lot of sleep reports now, along with like an ENT evaluation, that myofunctional therapy is actually being recommended because there's been some really great literature that has come out that supports myofunctional therapy and helping to reduce the AHI, which is our apnea-hypopnea index, which is how we get diagnosed into our, levels of sleep apnea. So any patient that has a CPAP can definitely benefit. Any patient that has a mandibular advancement appliance can definitely benefit. I did also see a question in there about if somebody has a mandibular advancement appliance, like how can Myo help with their occlusion? I mean, first and foremost, we always want to recommend our morning repositioner. I think that's really important. It doesn't take a very long time. Every patient should be utilizing that. But the myofunctional therapy is going to help increase the efficacy of your oral appliance therapy and also make it more comfortable for the patient to just like literally have it in their mouth. And then did I answer all the questions up?
I'll read it for you. Do I need to find someone who's in need of myofunctional therapy as a case study to be licensed? And what if I don't have anyone? I guess it's that fear that we had as dental hygienists trying to find your board
Okay,
patient.
right. So, okay. First, I just want to say part of my course, the last week, the eighth week, is case study presentations. And that's not me presenting case studies to you. That is each participant presenting their own case studies. So you're going to already have left the course starting your first patient. That patient can be yourself, it could be a friend, a loved one, an actual patient from wherever you're working. So I just want to put that out there. And then that patient could eventually be one of your patients for your COM certification. You are going to need multiple patients for your board exam. So that's why I say it's going to take some time before you actually get certified because you're going to have to start seeing patients through different levels of therapy. But again, don't let the fear of not having patients keep you. Maybe now might be a good time. Can we maybe talk about like the internship?
Yeah,
Uh,
sure. Absolutely. Yep.
so one of the really cool things about the course is after you finish the course, you are eligible for an internship through Tooth Pillow, where you can be a virtual myofunctional therapist as soon as you graduate from my myofunctional therapy course. In that internship, it's a series of 10 patients that you are mentored through by either myself or the other director of the myofunctional therapy program at Tooth Pillow. And again, this is completely virtual. So wherever you are able to apply for it. The one thing I will say, I'm sorry, my Canadian friends, we unfortunately can't offer the internship quite yet to you, but as soon as we expand into Canada, we will be able to. So please stay tuned for that. But this is really cool because that is everybody's like biggest fear, right? Like we want to see the ROI. We don't want to take this course and then not be able to do anything with it. So to be able to finish the course, apply for this internship, and literally start putting everything you learned into practice immediately and get paid for it. So it is a sliding scale as far as the payment goes, and we can get into the, details of that once you are at that point. But just know that that is a really cool opportunity with our myofunctional therapy course at the end. So that career advancement and um, what was I going to say? Professional, what do you call it? Professional. I can't think of
Application? Application?
application. Yes, thank you.
Okay, there we go. All right. And then here's because you're the director of myofunctional therapy at Tooth Pillow, and I'm the chief education officer there. So it's everything's connected, and that's really why we want to try to bring this all together because we do need more myofunctional therapists as the needs grow. So we're really happy to offer that as well. So let me just see if there's any more questions here. How many people are accepted for the internship?
So we hire monthly new interns. So every month we're hiring new people.
Great. And is diet nutrition part of your care plans? I'm just I want to get everyone's question answered and then we'll go over some more of the courses.
Yeah, yeah. So we do talk a lot about, diet nutrition in terms of like allergies, in terms of muscle function and jaw growth and development, inflammation, like especially our TMD patients. You want to make sure, that your clients are eating like an anti-inflammatory diet. So yes.
Okay. Do you send letters to ortho office when a client is in active treatments with your findings and recommendations?
100%. That is so important. Like honestly, and I learned this from Dr. Boyd. Even when you're seeing, say, like a pediatric patient, unfortunately, many of you are going to find that the pediatricians aren't usually going to be your referral source, but you should always send the pediatrician a copy of your evaluation report because they need to see and start really understanding and appreciating what it is that we do in this airway space. So, yes, you want to absolutely send it to any of their providers, really.
Hi. I think we're good with the questions. Maybe you could just answer Rosemary in the chat when you have a chance about that specific question. But let's talk about your School of Maya. I know we talked about it a little bit, but maybe it's starting April 2nd. The next one is June 4th. It's usually every 2 months that we go with our cohorts. And let's talk about some of the exclusive perks. Here are two right here. That's really they have part of the coursework as well, and we do have access for questions and guest spots when applicable. And
Lauren, one thing, your slide's not big. I see like the presenter view version. I know
better?
my eyes. I need the big thing. Yep.
Better? Is that good? Okay.
You're good.
So let's talk a little bit about the community support, the monthly case review, and the in-office shadowing opportunity, maybe in a little bit more detail. Um,
Yeah, so okay, we already talked about the WhatsApp group. We do also have monthly case reviews. So similar to what we do in our 8th week, where you come with a case presentation, we continue that on. And basically, I just ask for a volunteer every month. If somebody has, a case that they're struggling with, that they just want advice on, maybe you have a case that you're just really proud of and you want everybody to see, the results. Like I want to highlight you guys for sure because it's really cool to always hear your feedback and hearing your success stories with your patients. But it's also just then a learning opportunity for everybody else, right? So that is we just actually started doing that and it's been really cool and exciting. Like I said, the WhatsApp group, that's just an ongoing everyday conversation between us all. I also try to put in there like any upcoming free CE lectures, anything cool that I come across that I think you'd be interested in, I try to just slide it in there as well. So aside from just being able to ask your questions in there, there will be some other educational opportunities. We talked about if you want to come down to Connecticut and you want to shadow myself and my staff, or if you want to do it virtually, we'll make sure we have a good lineup for you guys. Depending, of course, we'll meet before and see like what it is exactly you're looking for. Obviously, if you're only treating adults, I'm not going to have you shadow a day where we're seeing a lot of pediatrics. So we'll make sure to get it, in tune with what your goals are.
And this is actually 7 hours of live CE, so we could even that could even apply for someone who want to take it on demand, perhaps for the intro course.
Yeah, absolutely. To be able to have the full 28 to get your certification.
Okay. And then we talked a little bit about the IAOM. There's a $25 code. It's pretty simple, 25 off. So if you're interested in that membership, and we can want to talk since you're on the board, I'm always happy to promote the IAOM, if I can say
Yeah,
it.
I mean, I think, again, especially if you're going to become a myofunctional therapist, I always think it's so great to be part of a professional community. The work that the IOM, has done, is doing, will continue to do to support us in our professions, regardless of our discipline. It's a very welcoming environment, again, regardless of who you are. Unfortunately, it hasn't always been that way in the past, but it really is now. We have a really, really great president right now. Joy Lance is amazing. And the ideas that she has for the IOM in the near future are incredible. So stay tuned again for more updates. But I really think that, when you're going into any kind of specialty, again, to be able to have that community behind you, I think is really important.
Absolutely. And we're happy to have us an exclusive flash sale. This is only for our live participants because we value you and your time. So those who are with us tonight, we have the attendance list. So please, if you're on the fence, this may be your sign to go ahead and take $500 off of the intro courses until midnight of March 21st. So that code is MyoFlash500. So we hope that we get a couple of more therapists. And then let's talk a little bit about the business success course, because I believe that flash sale applies to that as well.
Yeah, absolutely. So again, I think that one of the other things that hold people back is not understanding how to run a business, right? And even if you're not going to go into private practice and have your own, myofunctional therapy business, that's totally fine. Like I have a lot of colleagues that do myofunctional therapy very successfully in their current dental practice and they love it. And it's important though to still have those business savvy skills because you want to make sure that you're protecting yourself. There should be contracts involved. We talk about certain things that you want to include, how to protect your intellectual property, because most of the time, after you take this course, you're going to be building this myo practice, or I'm sorry, this myo component into your current dental practice. So again, we want to make sure that you feel valued. So we talk about that. We talk about, different ways to implement myo into the practice. We go through, different softwares, how to keep everything separate. There's a lot of templates that I provide for you guys, to take the guesswork out of, as much as I can for you guys. Um, we have like a business plan that I kind of have you guys follow as well. We talk about marketing, these days, especially social media marketing is very important. How to kind of grow that. Um, yeah, there's a lot of different, I think I covered it all, but again, we have
I
this all
do.
listed
Yeah.
too.
Okay. So let's keep going here. Let's talk a little bit about our mini myology course.
Yeah, so I love this course. So this is for our little ones. So typically we're starting a full myofunctional therapy program somewhere between age 5 and 6. It's going to depend more on, the specific patient, maturity, behavior, and whatnot. So what happens for those, 2, 3, 4-year-olds that aren't quite ready for a full myofunctional therapy program, but we're seeing signs of dysfunction, right? Again, we don't want to wait. Waiting's not going to do anything. These issues aren't going to correct themselves. So there are things that we can do to just help to build good foundations for muscle function, help correct oral habits, help correct, if they're thumb sucking, finger sucking, whatever it might be. And so that's what this course is for. A lot of myofunctional therapists don't feel really confident treating this age group, and it's fun. It's really all about play, and we talk about that and how to kind of, shift gears, how you would conduct a typical myofunctional therapy session with an older kid and adult, and how you can make it more fun and engaging for a 2, 3, or 4-year-old.
Okay. And then the newest course is Mastering Tongue Tie Readiness, which we probably get the most questions on. So let's talk a little bit about this option.
Yes, I love, this is one of my favorites too. So I get a lot of questions after the course. Again, we go into total oral tissues, but I need to just tell you guys, like any introductory course you take, we have to introduce you to all the concepts. So it's not, you're never going to get one subject honed in on, right? That is what advanced courses are for, which is what this course is. So a lot of people have questions on, um, really just further assessing how to properly assess a tongue tie, how to know if a tongue tie actually has to be released, how to know when the right time is for a tongue tie or lip tie or whatever tetheral tissue to be released. I go over like what my protocol is, what are my absolutes before I give like the green light. Again, there's templates in here as far as like readiness letters for you to send to your release providers, how to keep those lines of communication open, the other providers that should be on your collaborative team when they come in. Again, that's going to depend on different ages. I go through my protocol for active wound management. I take you through some case studies as well, and I take you through case studies in the mini myo course too. Really, all the courses that I teach, I think it's important that you actually see like demonstrations of putting everything like into clinical practice.
Wonderful. Thank you. Let's a little bit about Airway Palooza. I'm not going to get too much into detail on this, but this is exciting. It's October 17th, 18th. Rumor has it that we may have a Myofunctional, the workshop the day before. So I'm just going to tease that a little bit. But just we are open for registration. We actually do have pretty close to 75 people registered already. So that's really exciting because we didn't really do a full launch yet. So keep that in the back burner or feel free to take advantage of the $200 off and join us. We do also have payment plans as well. And then we are up at 9 o'clock, and I like to be on time, and I want to have a lucky raffle winner. So I'm going to stop sharing my screen and let Jay take the wheel because he's so much better at this than I am. And I'm really excited for this lucky winner. So if it's someone who is already a myofunctional therapist, you'll have access to the business course. So let's see, you have to be present to win. Okay, Jessica Briscoe. Let me just see if she's here. Jessica, I hope so. Let's see. Yes, Jessica Briscoe. I'm gonna allow you to talk because that. Oh wait, she's there. Yay, you're with us. I'm so excited. And maybe in the chat, are you new to Maya or you're an existing Maya? That's so funny. You just also thanks us for the info. New to
New
Maya. Okay, so we
bio,
have a
yay!
myofunctional therapist. This is your destiny, Jessica. I love this. Thank you so much. And we'll do this every time we have a Q&A session because it's really a great way perhaps to get Myos who weren't thinking, and this is that push that they need. So thank you, everyone. Brittany, why don't you close us out with just like words of enthusiasm, encouragement, excitement, just go for it because, change is never comfortable and change is never easy, but it sure is the juicy part of life.
Oh my God. Well, you just closed us out. That was perfect.
There we go.
I can't top that. Thank
All
you.
right, well, we'll keep it
Because my
brief.
brain
And
right now is
change
not
is
going to
the
answer.
juicy part of life. Engage, enjoy, don't be afraid, don't let fear guide you. And patients need you, and you will be a wonderful, wonderful asset to your patients in the community. Did you want to say
Invest in
something?
yourself. Yes, invest in yourself. I feel that we don't do that. We don't do that enough.
Okay, wonderful. Thank you, everyone, for your commitment and all you do for your patients. And we're here if you need us. And hopefully, you'll join some of our courses and we'll become alumni all together. And thank you for our current alumni for being with us as well. Have a great night. Thank you so much, Brittany, for your time. Appreciate it.